Hi, I'm Dr. Bethaney Brenner, and I'd like to introduce my patient, Emily, who came to us for help for her TMJ issues. Emily, you want to tell us what brought you in?
I have been to many dentists over my lifetime, and I had braces when I was younger, and I still kept having issues, nonstop cavities, even though I was taking really good care of my teeth. Dentists wouldn't really believe me. My mom had to be like, no, she really is. And then I went to a few adult dentists who were very invalidating of my anxiety, very much didn't care. I had one where I kept coming in and said, it hurts, I couldn't floss. And they were so demeaning, so demoralizing. And then I ended up at the one I was before, two before here. I've been to quite a few because ultimately for me, I want to not feel like just a number. I don't want to feel like I'm here for you to make money off of. And the last one I had been to had some solutions which might have worked for me, but I didn't hear about how they don't always work until I came here, and it was over $10,000 the treatment would have been. And so Dr. Brenner actually helped me find out an appliance that puts my tongue exactly where it needs to be while I sleep and my jaw exactly where it needs to be. And the amount of just relief that I have found, it's like my worst day now is nothing compared to what it used to be.
Well, you also have a very special condition. Emily has Ehlers-Danlos, which is a more ligament laxity around joints and especially the jaw. And there are some other special side effects that they have to deal with. And I would say, based on what we've done with you, we've seen an improvement over your overall Ehlers-Danlos situation. Just since you've been wearing the appliance.
Well, and because here, I feel like there's a real focus on total body. Like, you're the first place that really believed me that I brush my teeth fine, and you explained it having to do with the acid, and if your whole body isn't healthy, then your teeth aren't going to be healthy. And so I know so many people like me who have IBS, who have all different issues with IBS, but they have all different kinds of issues and their teeth are not the greatest, and you're the first person. I mean, frankly, for me, I saw on her website that you have sedation dentistry, and I didn't need that, but I was like, that's going to be somebody who knows that, like, I just need a little bit more reassurance and then I'm fine.
Well, you had a lot of anxiety when we first met, and to be able to work with me and me to be able to work with you so that we heard each other, and I particularly think that's important, that we were meeting your needs as we were going through the process. And I always make sure that you can always contact me. You can text me anytime, day or night. Not that I'm going to answer in the middle of the night, but you get what I mean. So we felt that you had your needs met through the whole process. And of course, we've become good friends through this thing as well, because you're such a delightful young lady. Anyway, is there anything else you'd like to add? Would you do this again?
Oh yeah, like I am. So anything to add? I'm going to be here until she retires because she has brought me, not only in the dentistry world, just in general, introduced me to physicians and to different programs and different ways of living that have helped me all around. So like for me, she's not just my dentist. She's the one that gave my primary care the answers that she needed for a lot of things through who she has introduced me to. And it's one of those, if you can trust her, you can trust the people she brings you to. And I don't do well with men, and one physician was a man, and I trust him completely. And I knew because I knew her, and she was friends with him through her own needing of his treatment. So not to go into other people, but I think for me, it's that when you say you do the best for somebody, it's not just through you listen. And even if like it means like charging as little as you're humanly possibly able to for a device because they want you to charge obscene amounts, like you'll do it. And so
I charge what I need to charge to be able to treat you. And some people are more complicated than others, right?
So I definitely, this is like the type of place where I would recommend anyone to go to. Not everyone likes the less traditional, old-fashioned way of dentistry, but it's not the best. And it's not the best in terms of longevity. I want my teeth the rest of my life. I've put too much love and care into them. And
we really have resolved a lot of that.
Yeah. Oh, yeah. A lot. I haven't had a single cavity while I've been here, whereas other dentists, I was getting 2 or 3 fillings every time I went to the dentist. And like, if you looked in my mouth, you can tell my molars are barely molars anymore. A couple of them kind of, but I've had so many teeth pulled as adult teeth, so it's nice to
We don't want any more of that going on.
No.
Anyway, thank you, Emily.
You're very welcome.